Hi, everybody. Thank you so much for joining us today. I am so lucky, and you are so lucky about the people that I'm talking to today. They're both very important people in Los Cabos that have really made a difference in this town, and you don't even know about them. First of all, we have Paulino and Karen Colobo. These people have played such an integral role in the healthcare system in Cabo. And you've been doing this for a long time. So I'm super thrilled to be able to introduce them to our audience. We're going to start by talking to Paulino about the history of what brought him to Cabo, and then how he met Karen, and kind of what his mission was when he came to Cabo. So thank you for joining us today, both of you. I appreciate it so much. And tell us a little bit about your background and what brought you to Los Cabos.
Well, thank you, Kenda. This is awesome. Thank you for being here. Yeah, we came to Cabo, my family and I, in 2009, with a mission to change the health industry in Cabo. The town was growing and growing, and many hotels and homes and everything, but the healthcare part was lagging. So I partnered with a friend, and we decided we had to build and manage a hospital with the same level of service that the hotels and the developments were built. So we started this company in 2009, and we raised the funds. We talked to different hospital operators, and we started building hospital in 2014, and we ended up opening after a little bit after a deal a new hospital that was H plus or HMS. So that was my mission, to change the healthcare industry or the healthcare services in Cabo. We did that. I was actually the manager, the CEO of the hospital for many years, until a little bit before COVID started, and we actually sold our shares, our part in the hospital around 2 years ago.
What your goal was to elevate the level of healthcare services in Cabo, it worked, because when Achimas came on the scene, other hospitals started seeing that they needed to up their game. New hospitals were built, old hospitals were kind of remodeled and revamped, and you went on a mission to bring in some very qualified physicians from all over. And I have done multiple videos about Achimas because they saved my life. And I have other friends who have been in serious accidents, and Achimas was phenomenal. And I trust the doctors here more than I ever did any doctor in the United States. So personally, from me, who is sitting here talking to you today because of Achimas, thank you for the work that you did to put into bringing Achimas into Cabo and elevating the level of health services. That is huge for those of us who live here. So thank you for that. So you decided to move on, but I'm sure that your mission didn't just go away. You still had that mission to elevate the healthcare services that we have in Cabo. So how are you fulfilling that mission still, since you're no longer associated with Achimas?
Well, a hospital can do only so much. You're in a hospital for a few hours or a few days. You go into surgery. You go for a test, an MRI, whatever. But you need something more. You need to be taking care of your health all around and during the whole year, right? So Karen and I, in 2019, at the end, we decided to start a new idea, which was a different kind of pharmacy, right? So,
Well, there are pharmacies everywhere here.
Correct.
So that was a little ambitious.
Well, there are stores that sell medicines and drugs, But are they real pharmacies? I don't know. So we wanted to change this. We wanted to have a pharmacy that could sell specialty pharmacy that could sell dermatological products, prescription products, and you could talk to the pharmacist and not to a clerk, just a cashier that will sell you whatever you ask. So we do have a specialty pharmacy. We have more than 8,000 products. We can get you almost any product or any drug, any treatment that is available in the country, and we can get it right here in Cabo.
Wow. Karen, what did you do at Altrimas before?
I am a pharmacist. I was in the head of the pharmacy, in the hospital pharmacy.
Okay.
Paulino and I worked together for many years in different certifications and projects inside the hospital. And we could see that people got a lot of challenges once that they were discharged from the hospital. They can't find any kind of specialty medication, for example. They need to wait long times to get medication. And we talk about it and think that there were a better way to do it. So we decided to create WeCare.
I can tell you from a tourist or an expat perspective, when I first came here, I thought all the pharmacies had a pharmacist, like a licensed, educated pharmacist working behind the counter. I always thought, and it started to dawn on me that, wait, these people are not pharmacists.
That's right.
And tourists come here and they see all these pharmacies and they think that you don't need any prescription. You can just walk in and say, I want this and I want that, and you're going to get medication, and they just think that it's the same as it is. For me, I'm from the United States. They think it's the same, but it's very different here. And I think you just said they're run by a cashier. It's a store. It's not a pharmacy. So just like you saw the need for medical care to be elevated, the two of you realized, okay, the pharmaceutical world needs the same influence, the same elevated influence, the same positive influence to help people stay healthy year round. So as a result, you started WeCare. And what year did WeCare start?
The pharmacy started in 2019.
2019.
And we then evolved also to create a clinic.
Right. So now you have two phases of WeCare. So you have the pharmacy, which Karen spearheads. And then you also now, with your goal to provide a good, healthy life, have these great clinics.
Correct.
So talk a little bit about what the clinics offer and how they work.
The clinic is here at just in front of Hospital H. Mass at the medical offices.
Mm-hmm.
And we started this to create a like integrative health, so that you can have, as you mentioned, a healthy lifestyle during the whole year. So we have a walk-in clinic. You can come here. We have general doctors and specialty doctors all day long.
Okay.
So it's better to have an appointment, but if you don't have an appointment, you just don't come in and there will be a doctor.
Okay.
We do a lot of checkups. We have our own lab. We work also with hospital HBUS for anything that we do not provide. So, for example, you need an MRI, we can schedule that for you. You need X-rays, we can schedule that for you. If we can keep your medical records right here, and if we have an internist. And the main area of the clinic is one of our partners is Dr. Anna, and she is an excellent oncologist.
Okay.
And we have an infusion center here. So we have these beautiful rooms where you can have your oncology treatment, chemo, or whatever treatment you're getting, with the supervision of our specialty oncologists. And you can come see her, and we understand. And I personally have been through this with my family members, going through cancer.
Mm-hmm.
So we wanted to make this place where the patients really feel like they come into a nice place, clean place, and we treat you like family. It's not like going to a hospital, which can be very cold. You have to go to admission, then they'll take you to a room. This here will be waiting for you. You have your sleepers, and we get you the food that you require. We work with nutritionists. We also have another health coach that she can provide you with different solutions for your treatment or in your lifestyle. If you need a nutritionist, we work with the internist, which is very important when you have an oncology treatment. So we can find you this whole complete approach for cancer patients.
I didn't even know that existed in Cabo. I thought people were having cancer treatment had to go elsewhere. So that's terrific. What other doctors do you have in the clinic? What type? Do you have a
We have the dermatologist. Okay. We have a geriatric doctor, and what else?
Urgentologist, general physician. We work also with dentistry.
Dentist. Okay.
Yeah.
And clinical nutrition.
Okay.
And if you require anything else, we can find you that doctor for you. So
Okay.
in the US, it's very common so that you have your family doctor, right?
Right.
And so here you can come with your family doctor, can be the general doctor, or if you require a little bit more, you have the internist, and then those two doctors can open you a wide variety of other specialty doctors that they work.
Okay. Do they speak English?
Pretty much all of the doctors speak good English.
Okay. I know that it's our responsibility as expats to learn Spanish, but when you're in a medical situation, sometimes it's not a good time. You want to be able to understand.
No, here from admissions to the doctor, we can easily speak English to anyone.
Okay. And one of the services that you offer is like the general health screening check with blood work and just kind of does the whole body health system. Is that only here in the clinic or is that at the pharmacies? I know some of the pharmacies have a little clinic next to them.
Basically here in the clinic, but we also have another doctor office at the Chedraui location.
Okay. How many pharmacies do you have right now, Karen?
Today we have 8 pharmacies in 5 different cities. 3 of those are in La Paz, 2 in San Jose, and 1 in San Lucas.
Okay. Do you have the idea of expanding?
Yes, of course. We are close to open a new one in San Miguel de Allende, and we have 2 more in Carretera.
That's so smart. Yeah.
And we expand our services far beyond the walls of our pharmacies. We have an online store, and that can help people from every corner from Mexico to get the medication they need with ease. So we have that too.
That's amazing. That's wonderful. It's so exciting. Are you going to open any other locations for the clinic?
Not right now. The clinic we're focusing here in the Cabo area. We do have services if you require also to be checked at your home or whatever. You can call us, and we also have those services. We have and we will also be working and launching soon a program with the pharmacy and the clinic that we will have a new membership card where you will have discounts at the pharmacy. It will include some blood work, and depending on the level you buy. But you will also have a number where you can call any time of the day, and there will be specialty doctors on the other on the phone, and they can give you a consultation, and this will be included with your membership.
That's brilliant.
And that's 24 hours.
That's brilliant.
And they will also speak English.
That's incredible. I remember when I was sick last year, I was very ill. And I remember thinking, I wish that I had somebody I could call and just say, hey, should I go to the hospital or should I just wait this out? And I remember having that thought. I wish if I was in the States, I would have somebody to call. And I remember thinking that. So to know that that's coming is very exciting. Yeah, well, you can sign me up for that program because I'll be definitely in that program for sure.
In the pharmacy, we are really proud about our extensive inventory. We have more than 8,000 different products, including specialty medication, controlled drugs, over-the-counter drugs, dermatological items or products, I don't know, many other things. We work with many suppliers and partners, and we can get almost any kind of medication of the whole world.
Okay.
So no matter how specialized or rare it is, we can get it for sure, or we can do all that we can to get it. We comply with all the regulations in Mexico. We receive visits every, I don't know, often from COFEPRIS and other authorities. We comply with everything, so we are a real pharmacy. We can find real pharmacies with good advice about the use of your medication. And I don't know, the core of everything we do is guided by the same purpose to improve the quality of life for all the people that come to us.
I heard there was a COFEPRIS audit
Yeah.
in Cabo recently, and that a lot of pharmacies, we'll use that word, pharmacies, a lot of them had some very serious.
Exactly. Yeah, we received visits in that audit too, in two of the pharmacies, and everything was okay.
Wow.
Correct.
That's so exciting to know. And, I always wonder with some of these pharmacies around, if the medications are clean and pure, but I know for a fact when I go to WeCare, I know what I'm getting is what I
Correct.
want to get.
Correct, and that's the very important part of our job, to find the right with the real medication.
Yes.
We will never sell anything that we don't know where it comes from.
Yes.
So we do have a purpose, working every day. So our purpose is to help with your health, efficient, professional, and with empathy, right? So if we understand patient needs, and we understand how frustrating it can be in a foreign country not to find what you're looking for.
Yeah.
So we are here to help.
Especially when you're sick.
Especially, yeah, it's a terrible moment. Like,
It's a terrible
we
moment.
need to, even in the clinic or with patients or in the hospital, you need to understand, or like put yourself in the shoes of the person right in front of you, because he's living a crisis. You can bring your mom, your son, or even yourself, and you're feeling terribly. You don't know if you have you can find your medication, if you're going to find the right doctor, if you have insurance or not, how much it's going to cost. So we can work with you. We work with a lot of insurance companies as well, international and Mexican insurance here at the clinic, and also at the pharmacy, so that we can help you with all this process. We understand it perfectly.
That's so great. And I think a lot of Americans think that you can just go to the pharmacy and buy any medication that you want. Just go, like, I want this and I want that. But there are some controlled substances
of course.
here, right?
Yeah, for some of the medication we need a prescription, like in the US. Not as many as you, but some of them. But the best part that is that we can guide you to go with a doctor to get the prescription you need in case you need it.
Yeah, if you have your prescription from the US and it won't work here, we'll guide you to the doctor, and he'll evaluate you, and he'll give you a prescription and then for your requirements. Yeah, but it's very important that we comply with all this.
And I am so grateful for the two of you. You have made such a difference in Cabo. You should be the stars of Cabo. You should be the hero. We should have a parade for you, because wow, what a difference you made. And I know at least one person who benefited directly from the work that you've done. And I'm so grateful for you guys. So thank you so much. And if you have any questions about WeCare Pharmacy or Clinic, please just put them in the notes below. We'll make sure to get all of your questions answered. And I will also put information in the notes below about how to reach the clinic and how to reach the pharmacy, so that you can have WhatsApp numbers or website numbers.
And you can order your meds from. We have a WhatsApp chat from each of the pharmacies. You can have direct contact with them, and you can actually send them to your home. So
I didn't know that. Somebody asked. I told somebody yesterday I was doing this interview, and they said, "Do they send the medication to your home?" I said, "No, nobody does that."
No, we can do.
You do, okay. I love it when I'm wrong in that way because that's even better. That's so exciting. So wonderful. Well, thank you very much for your time today. And thank you for watching. I know this was a very beneficial video for you. And so thank you so much for watching. And we'll see you in the next one.
Thank you so much
Thank
for
you.
having us.